To welcome Dr. Kelsey Ambrose. Um, I'm going to allow her to introduce herself.
Sure. Thank you very much, Dr. Ingirani. My name is Kelsey Ambrose. I'm a fourth year integrative vascular surgery resident, currently studying at Western University in London, Ontario, here in Canada.
So thank you for agreeing to do this podcast on unionization for residencies. Can you talk a little bit about when did your program become unionized?
Yeah, that's a great question. And to be totally honest, I'm very fortunate that this union had existed well before I started residency. And it wasn't really something that I had really thought about much before because it's existed for such a long time. It's just sort of been very much something that just pre-existed that I guess I sort of took for granted. And so when I found out we were going to be having this discussion, I actually took the opportunity to look into it. And it's actually been around since the 1960s. So it's been around for over half a century now, sort of supporting residents across Canada.
So how exactly does the union support you as a resident in vascular surgery?
That's a great question. And I think when I really reflect on it, I think it's the fact that it's something that just exists, that it's something I don't have to think about. It's so, because it's been around for such a long time, it's so well integrated into the Ontario teaching hospitals here, into the Royal College and accreditation, that it's something that is very much just an afterthought, sort of as I previously alluded to. And it's something that I don't have to think about someone advocating for what my salary is going to be on a year-to-year basis or how my salary is going to be affected by inflation. There's a team that's out there that's doing that for me, that's making sure that I'm getting adequate pay for the work that I'm doing. And similarly, that's making sure that I'm being cared for from a wellness perspective when we're talking about things like duty hours, call limits, making sure that we have call rooms available in the hospital. There's a lot of other sort of wellness pieces as well that make sure that the residents are well and also that we're providing safe patient care.
Are all of the hospitals in your area unionized?
Yeah, so there actually isn't to my knowledge, you can't have an Ontario teaching hospital or a residency program right now in Ontario that isn't involved with PARO, which is the Professional Association of Residents of Ontario.
So you join the union when you become a resident at a particular hospital in Ontario. Is that across all of Canada?
Exactly. And it is sort of broken up on a province by province basis. So each province has their own specific resident union. But it does exist in each province. And exactly, it's almost like a default, like you match to a residency program, and sort of by default, you happen to sort of fall into this union that's advocating for your rights and for your pay and for your wellness. And there's a small union fee that comes off of your salary, but it's really not something that you notice, and it really means that you're allowed to focus on your own education and patient care, as opposed to having to worry about some of these other things.
So are there differences between the different provinces in terms of their union, in terms of their policies, in terms of their benefits?
Yeah, good question. I think there's a little bit of variation, and admittedly, not studying in other provinces, I don't know sort of some of the details of the contracts quite as nuanced in other provinces, but generally speaking, there's a little bit of difference in terms of sort of salary that's allocated to residents between provinces. And I think a lot of that comes just with different costs of living in different provinces. And there's going to be a few changes in terms of what sort of some of your healthcare benefits might look like. But generally speaking, a lot of the rights for residents are quite consistent and fairly uniform across the provinces.
So if you have a problem, how do you contact the union? How do you operationalize getting solutions?
Yeah. So every Ontario teaching hospital has a council of nominated representatives from the resident cohort that have really sort of taken this under their wing as sort of being representatives of that center, that teaching center. And so if you have any concerns, they're certainly readily available. You can easily reach out to them by email, or to be totally honest, we know many of them personally. We see them in the hospital, we work with them. So they're pretty readily available if you have any concerns. And sort of on a more like from a larger perspective, there's representatives that don't work in the hospital that are sort of employees of the union as well that are pretty easy to reach out to. So whenever there are sort of concerns about violations to sort of maximum call limits or unfair pay or any sort of concerns about wellness like that, they're pretty easy to reach out to and are pretty readily willing to sort of mediate those concerns between your program or between the hospital. They're pretty readily available.
So you're almost done with your residency and training. How does this affect you after your residency? Being part of a union now for the last couple of years, how does that help you? How did that change your viewpoint for when you graduate?
Ooh, that's a good question. Um, I think it's something that I recognize I will miss after I graduate because I think as we sort of move into the workforce and we realize that we all sort of become self-employed and we aren't part of this bigger collection, that maybe you lose a little bit of that power and your ability to advocate for yourself. And so, to be totally honest, I think it's something that will actually be a loss when I do graduate from the program. But
The reason
I certainly don't see it necessarily like having been a part of a union, having any sort of detriment to my career prospects. And I think a lot of that stems again from the fact that it's so commonplace, it's just expected here. Like everyone is in a union, so it really doesn't have any deterrence for us.
Because here in the US, we're still in the process of increasing the number of residency unions, a number of residencies that are involved with unions. As we said before, I think that COVID helped push that along a little bit, and it seems to be increasing more and more. I find that there's also a reluctance, especially among the surgical specialties, to be involved with the union and to be engaged with the union. Do you find that some of your medical colleagues are more engaged as compared to the surgical for whatever reason?
I think that's a really good point. And certainly, if there's one thing I have to reflect on in our union, it's probably that disparity. I think, as I mentioned previously, we're fortunate that there's a council of representatives at every school and every institution. But admittedly, if you look at the breakdown of those representatives, it's predominantly residents who are in family medicine or internal medicine. And I think a lot of that stems from the fact that there's real work that needs to go into being a part of that council and being able to put in the time and energy to be able to advocate for people. And while I certainly by no means am trying to say that I think the medicine residents or the family medicine residents maybe don't have very busy schedules, I think as surgical residents, we recognize that quite often we don't have some of that extra time or that extra energy to be able to contribute. And so certainly you might notice that some policies that sort of pop up in the contract are maybe certainly not detrimental to surgical residents, but maybe don't have the same sort of appreciation or nuance as if they were maybe formed by someone who is actively working in surgery.
I think this is an important trend that's happening worldwide to have trainees involved with unions. Some countries more so than others, and some countries have had it for decades, as in your case. We are here in the US are still exploring this and still trying to see what the advantages are and disadvantages are. But I do think it's an increasing trend. We're also starting to see that it has impacts after graduation, in as much that we're having an increasing number of practitioners after they finish their training who are hospital employed or at least employed in some type of model, which allows them to join into a union. So I think that's something that's growing and something that we need to talk about, the risks, the benefits. So when's the last time that you heard about a strike up in Canada involving one of the resident unions? Does that happen very often? What type of problems do you have with that? What
That's a good
are
point. And admittedly, and I can't say with any absolute certainty when this was removed, but our current union contract, we can't strike. So I can't think of, certainly not in my time, when there's been a resident strike. And I apologize. I actually don't know when that policy was removed. Because I think they recognize that if all of a sudden you lose your entire resident workforce from the hospital, then patient care becomes a real problem.
patient care is still a major issue. in terms of what the perception is of what the limits are in terms of collective bargaining.
Mhm.
But we are seeing more and more larger, prominent institutions here in the US that are becoming unionized. And I do think it's something on a worldwide scale is something that we do need to discuss.
Mhm.
So thank you. Thank you so much for giving us your perspective because I think you have a really interesting perspective and a really great experience.
That's great. I'm happy to. Thank you so much.